So a lot of women, they come to me, they say, "Doctor, I'm not able to conceive. What should I do?" Well, the first question that I ask is, are you having sex regularly? If you're not having sex regularly, which is at least 3 to 4 times a week, I know that is tricky in today's society where, the partner works, you work as well, you're busy, you're tired, there's no time to copulate after work. But if you are serious about having a child, you really have to find the time, aren't you? Because where are you going to find the time for the child? So you need to have regular sexual intercourse 3 to 4 times a week to increase your chances of conception. And this is because for some women, they do not actually know when they ovulate, or they're not able to time the ovulation. So it is important that you have it regularly rather than trying to time it around your ovulation. If you're able to time it around your ovulation, then that's good. But again, this can be unreliable. So remember, couples, sexual intercourse 3 to 4 times a week, as well as consider having sex around the time of ovulation. If you're able to time it properly, you can use ovulation kits, ovulation calendars that can help you to time your ovulation. So it's also important that you have regular periods, because regular periods will also give you an indication of when you're about to ovulate. If you're feeling hot, increasing your body temperature, this is also a sign that you are about to ovulate as well. So if you have regular periods, you've been doing the regular sexual intercourse, and maybe for the more than 6 months or more than 12 months, you're still not able to conceive, then it is a good idea to have some investigations done. So the first investigations that's usually done are called blood tests. Blood tests are to check your hormonal levels, because there's certain factors in your blood that might prevent pregnancy. So for example, you might have high levels of prolactin. Prolactin is a hormone secreted by the pituitary gland. This can suppress your reproductive hormones such as your LH and your FSH to prevent, preparation of the womb for pregnancy. You also need to know if you are ovulating, and one blood test that can check if you're ovulating is called progesterone. If, for example, your cycle is quite regular, you have 28 days in your cycle, you can do what we call a day 21 progesterone. Or if you have a 35-day cycle, you can have a day 28 progesterone. So usually done, 7 days before the start of your next menstrual period. Also, there are other conditions that can affect your ability to conceive, such as polycystic ovarian syndrome. So your GP will want to do blood tests such as what we call your FSH, which is your follicle stimulating hormone, your LH, which is your luteinizing hormone, testosterone levels, because your testosterone levels are usually found in high levels in men, but you can also find high testosterone levels in women, which can also increase insulin resistance and affect your ability to conceive. I talked about the FSH and the LH. It's a good idea to have a ratio of at least 1 to 1, because if you have a ratio of 2 to 1 or 3 to 1 between your FSH and your LH, this is usually a sign of hormonal imbalance that can affect ovulation and your ability to conceive as well. Other blood tests that can be done include thyroid, because your thyroid imbalance can affect your ability to conceive. And a lot of women don't actually realize that it's important to have swabs done. And when I mean swabs, I'm referring to vaginal swabs, pelvic swabs, because you could have a past history of pelvic inflammatory disease. Maybe you've had chlamydia in the past, you never knew, you didn't have any symptoms, and sometimes, or if you have active symptoms of chlamydia or gonorrhea, this can be picked up by doing swabs. In a lot of cases, you need a pelvic ultrasound. A pelvic ultrasound looks at your ovaries to check the quality of your womb, looking at, is there any increased thickening of your womb? Do you have any fibroids that might prevent you from getting pregnant? Do you have any cysts? Looking at your ovaries as well. And you might even need further investigations such as a hysteroscopy, laparoscopy, or a fallopian tube patency check, where basically a dye is passed through your fallopian tube just to make sure that there is no blockage of the fallopian tubes that might prevent fertilization, such as the sperm meeting the egg. But do not forget that it's also important that your male partner does what we call a semen test analysis. Now, it's usually thought that the woman is the one of the problem, and you find that the woman is the person doing all the tests. But fertility problems is a joint issue, and the man should usually be present when the woman sees a doctor, because the doctor will want to ask both questions. The doctor would want to know from the man, do you drink alcohol? Do you smoke? Do you wear tight pants? Because these are all factors that can affect the quality of your sperm. So men, it is also important that you go for a semen test analysis to check the quality of your sperm, the concentration of your sperm, the shape and the movement of your sperm. So the results of the woman and the results of the man would then determine what the next step would be in terms of conception. Do you need to keep trying? Do you need ovulation induction medication? Do you need IVF or other alternative treatments to help with fertilization? I hope you enjoyed this video. Please take good care of yourself.